child myself, and I am inspired to think that we don't have to have a world where being healthy is a struggle.
So we all know that there's a national crisis with the obesity epidemic, and even though Vermont is considered one of the healthier states in the nation, we have this problem here too. 59% of Vermont adults are obese or overweight, and 29% of our youngest Vermonters, aged 2 to 5, are above a healthy weight. And the incidence of obesity in adults and children has doubled in the past 20 years.
What we know from research is that the leading causes of obesity, type 2 diabetes, and other chronic diseases are the lack of physical activity and healthy eating in our lifestyles these days. So what the Healthy Communities Coalition is trying to do is to make the healthy choice the easy choice, where people live, work, learn, and play. So we're working with a wide range of organizations within communities, from schools and other youth-serving organizations to businesses, workplaces, neighborhoods, stores, and entire communities, to try to increase and improve the supports for people to get routine physical activity and to have easy access to healthy fruits and vegetables.
So one of the strategies HCC is using to stimulate policy systems and environmental change throughout Windham County is the assessment and planning process. Now with this, we're using a number of different assessment tools to work with schools, workplaces, after-school childcare sites, and communities at large to help them discover where they are in terms of policy and environmental supports for healthy eating and routine physical activity. And then we're using that information to create an action plan for improving and strengthening these supports. We've been offering the assessments for a short time, and we've already begun to see a number of exciting changes throughout the county.
I think we had accomplished a lot of our little goals, our kind of scattered goals, and we're really looking to have a broader view of health and wellness in the school. And it forces you to kind of sit down and look at your program and what you're doing and give some direction to where you want to go and to think about it that way. And I think, although we've had some successes in our individual little things, it's really nice to have that overall view and focus. And all the players were there, the nurse and the food services and PE and some classroom teachers and parents, and it was, I thought that was great. The main thing that came out of the process was the walking to school, and I know the state has a big push for biking and walking to school, and it's difficult in this area because everybody lives so scattered, far away, but we have applied for some money to put in a walking path and to try to get kids to walk on a daily basis. Even though they can't walk to school, they can walk at school.
The Community Health Index really helped, I think, all of us in that group take a look at what we're offering, what we're actually doing. That I think sometimes we do, we're offering things and we don't really realize that we're even doing it. So it was kind of eye-opening to realize that, well, we are really encouraging people to try to take a break during their work day and go outside and maybe take a walk if they have time to do that. The questions also help you, or they helped me anyway, think about not only what we were currently offering, but what else we could be doing that didn't cost a lot of money, that might be a really easy success story, a really easy win for the hospital. A great example of that is the cafeteria, the kitchen. We did the assessment and we thought, maybe we should just change the layout of the food. Everyone goes through the salad bar first, so everyone accesses the salad before they even get to the hot food. And before, people used to pick up the hot food bar, fill their plate, and then bypass the salad completely. So it's been a really, it was sort of a low-tech, almost a no-brainer kind of shift in flow that's really impacted. We have 180 plus employees here, and they all eat lunch, so it's huge. That people are making, or have the option to make healthier choices first.
Our place serves meals Monday through Friday, breakfast and lunch. We always serve fruit and vegetables and fresh salad every single day. And we have a food pantry that provides food to about 180 households every month. The average number of people that use the food shelf in those 180 households is about 510 per month. In our dining room we serve about 1,100 meals per month now. It's up from about 850 this time last year. Twice a week we get probably about 7 or 8 cases of everything from strawberries and blackberries to eggplants and cauliflower that we also either use in the kitchen, but often there's more than we can use in the kitchen, so we put that out for anybody to take too. And I hear this a lot, oh, I remember my grandmother, she had a garden and she canned and she did these things, but it's just a lot of those skills have not been passed down, and our lifestyles have changed. And we've been trying to bring people together from different organizations or just people that reside in the community to figure out how we can generate more, not just conversation about what the community needs, but actually community action about what the community needs. So in order to get some more information about what people were facing as far as access to fresh food in this area, we decided to do a food survey. We ask a lot of different questions in the survey, everything ranging from how many times a week do you shop to how do you plan your meals, what kind of access do you have to fresh fruits and vegetables, and all of the survey will be really helpful in informing the decisions that we make as far as what kind of classes or education or programs that we offer. Finding out what people's needs are through the food assessment is really very important for us, because otherwise we're trying to find solutions to a problem that may not exist really, and we want to find solutions to problems that people are having that we can actually make a difference.
As planners, professional planners, we're aware of the link between the built form or the way the town is constructed and people's level of activity, physical activity in it. We're aware that even though it's a small community and it's got a beautiful setting, people are heavily dependent on the private car as a means of transportation. And we're aware from our work using public health data that obesity is present in Brattleboro. It is an issue. It's particularly present amongst a segment of the school-age population, and that we've been involved in developing a draft town plan for 2 years now, and we set off with some goals around what we've now come to think of as livable communities. Chili process has been really important to us. There was a group formed in Brattleboro that was a really good cross-section of thought leaders and practitioners in the field. So it was made up of people from the health department, people from the schools community, people from the hospital and public health community, people representing AARP and the YMCA. For us, as part of the town planning process, what we've done is feed that information into chapters that address municipal facilities and services, and transportation. So a strong commitment to public transit, a strong commitment to making adequate accommodations for cyclists and pedestrians on streets. We can make small but important changes in policy and in action to encourage physical activity and to encourage an awareness of the relationship between the physical environment and activity.
I think that in general, I'm really encouraged by sort of the latent, maybe dormant interest that now with the catalyst that we're offering is allowing people to change.
We hope you've been inspired by some of the changes that you've heard about in this video. If you'd like to make the healthy choice the easy choice where you live, work, learn, or play, please be in touch with us. We look forward to working with you.